So what is this tummy tuck or mummy makeover procedure? And today we'll be talking about lipo-abdominoplasty or simply called mummy makeover. So what is tummy tuck or mummy makeover? Basically it involves removing or excising the extra skin and fat from the lower abdominal skin and reshaping the abdomen to give it a firmer, fitter appearance. Those patients who have experienced a significant weight loss post-pregnancy or postpartum hernia surgeries or some abdominal surgeries which give the abdomen a stretch and loose appearance, the sag skin. These are the patients in whom this surgery is going to do miracles. So what is the purpose of this surgery? The purpose of the surgery is to remove the extra or excess skin and fat that gives the skin a sagging appearance, to improve the tone of the skin and the muscles, and to reposition the umbilicus which has sagged down or gone down. So to make a firmer, fitter abdomen by removing the excess and increasing the tone of the skin and muscle is the goal of the surgery. So what is the procedure behind lipo-abdominoplasty or mummy makeover? Basically, it involves giving spinal or general anesthesia. Preoperatively, patient is counseled about the procedure, about the postoperative care to be taken. On the day of surgery, under spinal or general anesthesia, the procedure is performed. Sometimes we combine liposuction with abdominoplasty to achieve a better results. So, with the help of liposuction, the flanks are thinned out, extra fat is removed, and the skin is thinned out. That makes the postoperative abdomen firmer and fitter. After liposuction, a skin cut is made in the suprapubic region. This is the region where generally pregnancy scars are present. The pregnancy scars are excised, the skin is cut, and this skin is elevated. That is, the skin is lifted from underlying muscles. The extra or excess skin is removed in toto. This is the skin which has most of the stretch marks or striae. So when we remove the skin, half of the stretch marks or striae are already gone. After this, the muscles are toned, they are sutured. Generally the muscles in the center and on the sides, these muscles are sutured, so that gives a firmer and toned feel to your abdomen. This extra remaining skin is then redraped. The umbilicus, which is sagging or gone down, is repositioned. This is called as neo-umbilicoplasty, that is, umbilicus is newly formed. After this, the wound is closed with the help of sutures that are seen inside the skin. So the skin is redraped and sutured back to your abdomen. The extra part is gone. The skin looks firmer and fitter. Post-operatively, some pressure dressings are to be given. These dressings may remain for the period of 4 to 5 days. So what is the post-operative care for abdominoplasty patients? Post-operatively, generally by second day, we encourage the patient to move around. This mobility is important to prevent any post-operative complications. The patient can restart his routine activities by third or fourth day. We advise the patient to avoid any strenuous activities, avoid heavy weight lifting for 3 to 4 weeks of period. By 5th or 6th day, we remove the dressings and then patient is given an abdominal binder or pressure garment. The pressure garment is basically to redrape or contract the skin, which will give a better result to our surgical procedures. Some painkiller medications and antibiotics are to be given for the period of 5 to 10 days. By the end of 3 weeks, most of the wounds are healed, any swelling, bruising or pain is subsided, and patient can resume his daily activities without limit by the end of 3 weeks. Results. Generally, the results of abdominoplasty are seen by the end of 3 months. That is because after the wound is healed, the skin is continuously remodeling. The skin is redraping itself. The skin contracts, it shrinks. The postoperative edema subsides, and the final shape of abdomen is seen by the end of 3 months. So even though the wound healing may happen in 3 weeks, the final result takes around 3 months to be seen. Thank you.